on the overall health of my teeth. So I figured I would jump on here and do a quick update. I failed to update you guys like 5 months ago on my last dental exam. I go next month for another dental exam. So at my previous one, back in the summer, I had 0 cavities still, which is really good. I had some x-rays done at the visit before that one. So next month, whenever I go back to the dentist, I will probably get some x-rays done because it's usually like once a year. And depending on your insurance, you can do like the panoramic that goes all the way around, or you would do the bite wings, which I hate those things. They're not as bad as they were before I got my teeth straightened, but they're still uncomfortable. But anyways, I am actually headed to my orthodontist appointment right now. It's been a year since I've been to the orthodontist for a retainer checkup. Obviously with COVID and everything that's been going on this past year, things have been crazy. And I suspect now that things are probably going to get a little more crazy with, you know, the flu season being here now, or well, right around the corner, I should say. So I'm trying to knock out all of my appointments before it gets too crazy. But yeah, that's where I'm headed. I think everything is okay as far as my retainers go. I keep getting asked this question, what retainer do I like to use the most? Because most of you that have been following me here know that when I first came out of ortho treatment that I was given a set of clear retainers, and then after that I had ended up getting the Holly retainer. And typically I just wear my clear retainers because the Holly retainer is just big and I don't feel like it really encases my teeth as well as the clear retainers do. So for that reason, I wear my clear ones. They feel a little more snug on my teeth, and I enjoy the comfort of those over the Holly retainer. Yeah, typically I like to wear my clear ones. I am taking my retainers with me to this appointment so that they can overlook them and make sure that they all look up to par. My retainers, I got the clear ones as soon as I came out of braces, have started to get bigger cracks in them along the like canine teeth, and so I started wearing my other clear retainer that I had made after that. I guess it was a few months after that appointment. The other one just started feeling a little bit looser along my teeth, and so this other one feels a little bit snugger and tighter. It kind of, I think over time, retainers, the clear ones, lose their tightness because the plastic in them wear down over time, and I've had these retainers now for a couple years, so you know, it's expected. As far as like teeth movement goes, I have noticed this tooth right here wanting to overlap that one, which before I went into braces I was dealing with these two teeth on the side overlapping my front ones, so I'm a little concerned about that. I also have a lower my first premolar here, it's kind of it's turned and slipped off of my tooth behind that one just a little bit because it had what they called IPR, where they shave in between the teeth, and so I can feel that perfect shave with my tongue on the other tooth, where that other tooth, this one here, isn't lining up with that one now, which it's been like that for a while. I don't really have any urgent issues, it's just a regular checkup, but if there is anything I need to update you guys on when I get out, I will do that. Alright guys, I am out of there. So that appointment did not take long at all. I think the longest part was just getting to chit chat and catch up with the ladies in the office since it's been a year. They're such a great orthodontist. I kind of miss going there every few weeks because you can just connect with everybody there on such a good level. But anyways, so while I was there, I ended up going on ahead and having one of my teeth that has the bonded retainer on. The glue was very edgy and it had actually come away from the tooth. So even though my retainer is still in place really, really well, they went on ahead and now I got some traffic. They went on ahead and just re-glued it to the back of my tooth, which feels much more snugger than it did. And I've also got some retainer cleaner, which I've heard of it. I can't remember what it was called. I've seen it advertised and stuff, like in ads and stuff here on YouTube, but this is called Retainer Brite, and it came in some little bags like this, and they're just tablets, basically kind of like denture cleaner. You use it, she said, like once a month, which I have used denture cleaner, but I've never used the actual retainer cleaner, which I'm pretty sure it's the same thing, it's just called a retainer cleaner. So if you have clear retainers and they are looking a little foggy, discolored, one of the things that you can do to take that fogginess out of them is you can place them in this denture cleaner, and I'll have that linked in the description below this video for you guys. But basically what you do is you take a tablet, you put it in some warm water, you let it dissolve. The water cools down because you don't want to put your retainers in it with hot water, but when the water cools down, you place your retainers in it and you let it sit for however long it states on the paperwork that actually comes with that retainer cleaner, and then you take them out and you just rinse them off and you're good to go. But you only want to do that once a month, she said, and it does kill like 99% of bacteria, so that's really good. So because it's been a year since I've been to the orthodontist, it was a lot different this time. When you get in, they obviously do the temperature check and the sanitizing of your hands and all that good stuff. I had to fill out some paperwork based on if I've traveled or not out of the States or within the US, and if I've ever been in contact with anyone with COVID, which I haven't. As soon as I got back to a bay, they had me wash my hands and also rinse with mouthwash for 60 seconds, which was actually interesting. I like that concept because you figure you got people going in your mouth, you know. And when I went to my dentist appointment, like I said, 5 months ago now, I didn't have to do that then. So the fact that they had me do it at this appointment is actually not a bad idea. So if you're in the dental field, I would recommend that to your patients. I think that's actually quite smart. I'm not due to go back for another year, and as long as everything continues to go good with my retainers and my teeth, I just stick it out another year. That's pretty much it. That's how my appointment went, and I go next month for my dental cleaning, like I mentioned, and I'll update you guys, let you guys know how that goes. I do apologize for being super delayed on my dental videos, but it's just so hard. I've been in the midst of moving, and we got a new house. We sold our last one, and we're also in the middle of remodeling the current house that we bought. So it's just been busy. Oh, and I've been homeschooling 3 of my children, which I've never done before. So it definitely eats up a lot of time in my day. But other than that, I will do another video update for you guys next month when I go to my dental cleaning, or if anything changes as far as my retainers and teeth go. All right, guys, see you again next time. Bye.